Okay, welcome to this explainer. Today we're diving into something that is absolutely crucial, but honestly, it's often completely misunderstood when it comes to women's health. We are talking about ovarian cysts and tumors. Now, I know this is a topic usually shrouded in fear, a ton of heavy medical jargon, and unfortunately, way too much silence. But we're going to break the whole thing down today, step by step, so you know exactly what's going on.
Here's our quick roadmap for how we're going to tackle this. We'll start with the silent ovarian tumor, then move into size matters. After that, we'll cover twists, ruptures, and severe pain, look at endometriosis and some pretty surprising cyst contents, and finally, wrap up with why annual checkups matter.
All right, let's jump right into part one, the silent ovarian tumor. What are we actually dealing with here?
Before we even touch on things like swelling or tumors, I kind of want to test your spatial awareness of your own internal anatomy. So, take a quick guess. How big do you think a perfectly healthy, normal ovary actually is?
Well, the answer is roughly 3 centimeters, and this is a really foundational point, right? A healthy ovary is tiny. It's essentially about the size of the tip of your thumb. I want you to keep that specific image in your head as we keep going, because it becomes incredibly important when we start talking about just how much these organs can actually expand. Now, we absolutely have to separate the scary medical jargon from reality. When someone hears the word tumor or cyst from their doctor, pure panic usually sets in. People immediately jump to, oh my gosh, tumor equals cancer. But actually, scratch that. In gynecology, an ovarian tumor literally just means a swelling or a fluid accumulation. It does not automatically equal a malignant cancer. It could be totally benign, meaning completely harmless, or borderline, which just means they need to keep a close eye on it. But just having a swollen, fluid-filled ovary is really just step one of figuring out what's going on.
Which brings us nicely to our second section, size matters, and specifically, when to actually worry.
So how do doctors evaluate the risk? Well, anything up to 3 centimeters is perfectly normal. Remember that thumb tip? But if it measures between 3 and 6 centimeters, you enter this sort of watch and wait phase. Doctors are going to want to check in every 3 to 6 months just to see if it shrinks on its own or keeps growing. Step 3, though, is where the medical alarm bells start ringing. Passing that 6 to 7 centimeter threshold is when surgical intervention really has to be heavily considered, just because the physical risks of leaving it in there become way too high. And those sizes, they can get extreme. This is honestly one of the most baffling parts of this whole condition. Because the ovaries are nestled so deep inside the abdomen, they have all this extra room to just silently expand. In fact, an ovarian tumor can grow to mimic the size of a full-blown pregnant belly, up to 90 centimeters. And here's the craziest part. Someone could have a totally slender face, slender arms, no weight gain anywhere else whatsoever, but be carrying around a massive 90-centimeter swelling in their abdomen without feeling any early pain. It's literally entirely silent.
Let's move into section 3, twists, ruptures, and severe pain. Because that silence, it doesn't always last. This brings us to a frankly terrifying complication called ovarian torsion. Think of your uterus right in the center, and the ovaries are hanging off of it by these supportive ligaments, almost kind of dangling there. When a swollen ovary gets too heavy, usually when it hits that prime danger zone of 5 to 7 centimeters, it gets super top-heavy, it can physically spin and twist its own connective ligaments, entirely cutting off its own blood supply.
When that torsion happens, or if the stretched ovary finally just tears and ruptures, that completely silent phase we talked about, it ends in a fraction of a second. It hits with this sudden, blinding, unbearable abdominal pain. This is not the kind of cramp you can just sleep off, you know? It almost always means an immediate, frantic trip to the ER, usually ending in an emergency night surgery to either untwist the ovary or stop the internal bleeding.
Okay, on to section 4, endometriosis and surprising contents. Let's look at what's actually inside these swellings. First up, we've got to talk about endometriosis. Normally, your uterus builds up this thick, fluffy bed of tissue every single month to support a potential baby. If no baby comes, the lining sheds. That's menstruation. But endometriosis is basically a glitch in the system. That exact same fluffy tissue starts forming outside the uterus, and in this case, specifically inside the ovary itself. Because this tissue acts just like the uterine lining, it bleeds every single month. But trapped inside the ovary, that blood has literally nowhere to go, so the ovary just swells up, month after agonizing month. And I cannot overstate how devastating the pain of this internal bleeding can be.
Patients express this profound, heavy emotional toll. We're talking heartbreaking realities, like being completely unable to have intercourse, because the inflammation makes the surrounding tissue so hard and rigid. It strains relationships, causes intense psychological distress, and can leave patients feeling utterly hopeless, like their life as a woman is over. But if you take away anything today, let it be this: there is hope. Modern hormone therapy and contraceptive pills can dramatically improve this condition. You absolutely do not have to suffer in silence.
All right, I'm going to pivot to something genuinely bizarre, like straight out of a sci-fi movie bizarre. We have to remember that ovaries contain the foundational, origin cells meant for creating human life, right? So when an ovary develops a specific tumor known as a dermoid cyst, it can sometimes glitch. Instead of just filling with fluid, those life-creating cells get confused and start trying to build body parts. No joke, these cysts can literally contain clumps of hair, pockets of fat, and even fully formed, hard human teeth. Imagine being a surgeon and opening up a cyst to find teeth staring back at you. Wild, right? But it's a real, naturally occurring medical phenomenon.
Let's bring it all home with our final section: why annual checkups matter.
We are so incredibly lucky to live in the medical era we do right now. I mean, historically, doctors literally just pressed their hands on a patient's stomach and guessed if something felt swollen underneath. Sometimes they'd cut a patient open based on a hunch and find absolutely nothing. But modern medicine is a total game changer. Today, we use MRIs and, crucially, transvaginal ultrasounds. Unlike pressing on the stomach, where normal abdominal fat can completely block the view, a transvaginal ultrasound gets right up close. It provides crystal clear imaging, meaning we can detect even the tiniest swellings way early.
And early detection is everything. Because, as we've learned, the trickiest part about ovarian tumors is their silence. They do not send you a warning text. And listen, you cannot prevent these things with diet or exercise. There is no magical superfood smoothie or gym routine that's going to stop your cells from forming a cyst or an endometriosis flare-up. Because you can't feel them yourself and you can't lifestyle your way out of them, proactive medical screening is your absolute best and honestly your only line of defense. Catching a cyst at 4 centimeters instead of 90 and ruling out hidden cancers early, that is literally life-saving.
Which brings us to the most important number of the day: 1. Armed with everything we've unpacked in this explainer, you need to commit to getting a proper gynecological checkup exactly 1 time a year. Just once. That is all it takes to keep a close eye on these silent organs.
So, I'm going to leave you with one final, totally vital question to think about. When was the very last time you saw your gynecologist for a checkup? When you were battling a truly silent threat, knowledge and timing are your only weapons. Please, do not wait for a symptom that might never even come. Book your appointment today and start taking control of the health you can't see.